Welcome to this presentation. It is an introductory presentation on the physiology of the respiratory system, and it begins by looking at the physiological anatomy of the respiratory system. Now, the respiratory system, just like many other systems, is a well-organized and tightly regulated system, and the main function is to make sure that there is oxygen available for the body to make use of to carry out various physiological and biochemical processes that happen in tissue cells. And on top of that, it also ensures that there is removal of carbon dioxide, as it is the major byproduct of the metabolic processes that happen in different body tissues and organs. So, in essence, the main and major role of the respiratory system is to carry out gaseous exchange. However, aside from these pulmonary functions, it also has other non-pulmonary functions that we will also delve into later on in this presentation. Now, let's begin by looking at the functional anatomy. Functionally, the respiratory system is divided into the lower airway and the upper airway. The lower airway and the upper airway. This is the functional classification of the respiratory system. The upper airway consists of structures from the nostrils to the vocal cords, which are the folds of mucous membrane within the larynx that vibrates to produce a sound. So these vocal cords vibrate to produce a sound, and in other textbooks you find that they are also referred to as the voice box. Then they are located in a structure known as the voice box. That's where you find these vocal cords. Then the lower airways consist of all structures from the trachea to the actual lungs. That is the lower airway. So, as can be seen from this diagram, you can see that from the nasal cavity there all the way up to the larynx, that is the upper airway. Then from the trachea there, coming down all the way up to these lungs here, including the bronchus, the bronchioles, the respiratory bronchioles, and the alveolar ducts, and alveolar ducts, as well as the alveoli. These form the lower respiratory tract. So this is the anatomical classification of the respiratory system. Now, the major function of the upper airway is to condition air by the time it does it reaches the trachea. Its major function is to do to condition air by the time it reaches the trachea. That is the major functioning of the upper airway. Now, this conditioning means it helps in cleaning off the air. It helps in humidifying the air and also adding a bit of some heat to it. That is what conditioning of air means. So the nose filters and entraps and clears particles larger than 10 micrometers in size. It also provides the sense of smell, that is the nose. So it houses the olfactory nerve endings, the nerve endings of the olfactory nerve that protrude into the nasal via the superior turbinates. That's why you find these nerve endings. So now these nerve endings, they carry impulses to the olfactory bulb by passing through the cribriform plate. That is what these nerve terminals are doing. So they carry impulses toward the olfactory bulb, passing through the cribriform plate. Then the sinuses, the sinuses are lined by ciliated epithelium, which facilitates the flow of what? Mucus. And on top of that, they help also to lighten the what? The skull, which makes it easier to make an upright posture. Then they also offer a resonance to the what? The voice. That is why when one has inflammation of these sinuses or sinusitis, the voice tends to get disturbed because the resonance there is disturbed. Yeah. Then the trachea. So the trachea consists of what? Cartilaginous rings throughout its length, and it bifurcates at the sternal angle of Louis to form the left and right primary bronchi. So the trachea being made out of what? Cartilaginous rings. It bifurcates, so as it comes like that, at the sternal angle of Louis, it bifurcates. So this point where it bifurcates, at this point there, it's called the carina. It has got clinical significance. Then it bifurcates into the left and right primary bronchi. Now the right primary bronchi is slightly less slanted than the left, which is more slanted and angulated. Hence, foreign bodies are likely to lodge where? More in the right lung. Why? Because this is slightly slanted, whereas this is more slanted. So meaning if one ingests something, or one inhales or inhales a foreign body, it is likely to lodge this side of the lung than this side because of the slantness that exists on the right side. Yeah. So this is what we are talking about. You can see that this is our trachea, and then we've got these blue things there. These are cartilaginous rings. Then at the sternal angle of Louis, there's a bifurcation point. So at this bifurcation point, that's where we have the carina there. Like I said, it is important. It serves clinical relevance and significance. So at its bifurcation point, it forms the right primary bronchi and the left primary bronchi going into the different lobes of the lungs, like this. So as you can see, as it enters, these primary bronchi, as they enter the lungs, they form the secondary bronchi going into each lobe. You can see one goes into the superior lobe, the other one into the inferior lobe on the left side. Then on the right side, one goes into the superior lobe, the other one into the middle lobe, the other one into the inferior lobe. As you can see that the right lung has 3 lobes, whereas the left lung has 2 lobes. However, there are various, sometimes there are cadaveric variations. You may find that the left lung has got 3 lobes, then the right lung has 2 lobes. But the most common finding is that most individuals have got their right lung having 3 lobes and the left lung having 2 lobes. But in some individuals, it may be found that on the left lung has 3, the right has 2. So there are those cadaveric variations. Now, physiologically, the respiratory system is divided into the conducting zone and the respiratory zone. Conducting zone and the respiratory zone. That is the physiological classification of the respiratory system. So the conducting zone extends from the nostrils up to the terminal bronchioles. That is the conducting zone. So the conducting zone extends. So the conducting zone extends from the nostrils up to the terminal bronchioles, and it includes structures such as the nostrils, the pharynx, the larynx, the trachea, the bronchi, and the terminal bronchioles. The main function of the conducting zone is to do what? To just conduct air entering and leaving the respiratory system. That's the main function of the conducting zone. It does not participate in what? Gaseous exchange. The conducting zone does not participate in gaseous exchange, but functions to do what? To condition the air. That is, to filter out the dust particles, to warm it up and humidify it. That is the main function of the conducting zone. It does not participate in gaseous exchange. So all the structures from where? From the nostrils up to the terminal bronchioles, these do not take part in what? Gaseous exchange. Then there's now a respiratory zone. So for a respiratory zone, it extends from the respiratory bronchioles, to the alveolar ducts and the alveoli. And the primary function is to do what? To carry out gaseous exchange. That is the main function of the respiratory zone. So as can be seen there, you can see that from where? From the nasal cavity there, all the way up to the terminal bronchioles, you have the conducting zone, whose main function is as for conduction of air. Okay, just to conduct air and in the process conditioning it. Then the respiratory bronchioles, from the respiratory bronchioles all the way up to the alveoli. So that means it includes the respiratory bronchioles, the the alveolar ducts, and then the alveoli now. So these are structures making up the respiratory zone, and the main function of the respiratory zone is to do what? Gaseous exchange. That is the physiological classification of the respiratory system. So yeah, as can be seen there, from the trachea up all the way up to the terminal bronchioles, then transitioning into the respiratory zone of the respiratory bronchioles and the alveoli and all those. Yeah. Now, the lung. So the lungs, a normal human being has got two lungs. That is the left and the right lung. And each lung is divided by what? Fissures in two lobes. In majority of individuals, the right lung has got 3 lobes, while the left lung has 2 lobes. In some individuals, it has been found that the left has 3 lobes, while the right has 2. Yeah, so those are the minor cadaveric variations that exist. Yeah, so as can be seen here, you've got the right lung has got this superior lobe, the inferior lobe, the middle lobe and the inferior lobe, divided by these fissures. So between the superior and the middle lobe, you've got this transverse fissure. Then between the middle lobe and the inferior lobe, you've got this oblique fissure. Then on the left side, you have the superior and the inferior lobes. Yeah, which is just the same again here, as can be seen. On the right side, you've got the superior lobe, the middle lobe, and the inferior lobe. Then this side, you've got the superior and the inferior lobes. So the right lung divided into 3 lobes: the superior, the middle, the inferior, which are all divided by the horizontal and the oblique fissures. Then the left lung divided in 2 lobes: the superior and inferior lobes, divided by what? The oblique fissures. So the left lung has also what we call a cardiac notch to accommodate the heart. So you can see that it has got this notch here. So this notch here is called the cardiac notch. This is where the heart fits. So the normal lung should have this cardiac notch. Then just covering the lung. So if this is our lung, there's a layer just above it. There's a layer. In fact, it is a membrane with the 2 layers. So this membrane, the inner surface or the inner membrane is called, this layer is called a pleura. Then the inner aspect is called the visceral pleura. Whereas this outer membrane is called the parietal pleura. So this membrane, the outer membrane, is called the parietal pleura, whereas the inner membrane is called the visceral pleura. So in between the 2 pleural membranes is a potential space that is filled up with a small amount of fluid to minimize friction between the parietal and the visceral pleura during breathing. So that space is called the pleural cavity. So this potential space, again, it serves clinical significance because fluid can lodge there, air can build up there, and anything that builds up there will interfere with breathing and will give to a wide array of the various conditions. So these membranes are important because they ensheath and cover the lungs. Yeah. Then the pleural fluid also helps in creating a negative pressure. So this negative pressure is important because it plays a role in in the mechanics of breathing and the various pressures that contribute to breathing, and we'll understand how this comes about, how this negative pressure is created and its importance later on. And there's what we call the bronchial tree. So the bronchial tree is simply a series of branching airways that transport air from the trachea to the alveoli. So as the trachea divides into the right and left main bronchi, then the main primary bronchi, 1 for each lung, then the secondary is for each lobe to supply each lobe, and then segmental or tertiary bronchi supply the bronchopulmonary segments, and then the bronchioles smaller airways. So the bronchioles, they lack cartilage, leading to terminal and respiratory bronchioles. Yeah, so this is our tracheobronchial tree. So you can see that from the trachea there, surrounded by these cartilaginous rings, at this point they bifurcate, then going to the primary bronchi go to each lung. Then these primary bronchi, they bifurcate or they divide further to form secondary bronchi, and the secondary bronchi, they go to each lobe. Then the lobes divide further, the tertiary divide, the secondary bronchos divide further now to go into the various units, okay, until they form alveolar ducts and alveolar sacs. So this is our tracheobronchial tree. It looks like a tree, hence the name tracheobronchial tree. Yeah. And there's what we call the respiratory unit. So the respiratory unit is the structural. It is the structural and the functional unit of the lung. Its primary function is to carry out gaseous exchange. So now what makes this respiratory unit? It is made up of what? The respiratory bronchioles, the alveolar ducts, the alveolar sacs, the antrum, and the alveoli. The antrum is simply the space in the alveoli. So That is what makes up the respiratory unit. So alveolar epithelium consists of what? Two types of alveolar cells, or the pneumocytes, which are the type 1 alveolar cells and the type 2 alveolar cells. Very important cells, and each plays a specific role and function. Now, the type 1 alveolar cells, these ones are squamous epithelial cells, and they form about 95% of the total number of cells in the lungs. The type 1. Their main role is for gaseous exchange. These are the cells that primarily act as the sites for what? Gaseous exchange. So these cells form the site for gaseous exchange in the alveoli. Now, the other type, the type 2 pneumocytes, these ones form now the remainder of the 5% of the alveolar cells. Their main function is to do what? Secrete surfactant and alveolar fluid. So the type 2 pneumocytes, or the type 2 alveolar cells, these ones, their main function is to do what? Secrete surfactant and alveolar fluid. So they also help to regenerate the damaged type 1 cells. So if the type 1 cells are damaged, they can be replaced by the type 2 cells, because they still have the capacity to differentiate into type 1 pneumocytes. So in summary, we are saying there are two types of cells in the lungs, the type 1 pneumocytes and type 2 pneumocytes. Type 1 pneumocytes are small and a lot in volume, in numbers. They are small and a lot in numbers. They are the major sites for what? Gaseous exchange. The type 2 are large but fewer in number. They are large, they make about 5% of the alveolar cells. They are large and fewer in number. Their main function is to secrete surfactant and alveolar fluid. Then they also can regenerate damaged type 1 cells. Now, what is this surfactant? So surfactant is a substance that reduces alveolar surface tension, promoting lung compliance, and preventing lung collapse. So surfactant is simply a substance that reduces surface tension in the lung alveoli. And this surface tension, this is just a force that tries to collapse the lungs. So because of, if you look at the alveoli, each alveoli has got what? Alveolar fluid. Now at this interface of the alveolar fluid, it tries to, there are forces that try to collapse or to draw this lung alveoli inside to try and collapse it. So the forces that try to draw in this alveoli, that is surface tension. So what surfactants does is that it breaks down some of this surface tension that exists there. So when it breaks it down, meaning the tension pulling off on these walls of the alveoli reduces, and if it reduces, meaning now this alveoli can easily be inflated. That is what compliance is, the ability to just inflate and increase in size when the ability to increase in size when inflated with air. So that's what surfactant tries to do. It tries to eliminate the tension that tries to collapse these lungs. So it is composed of what? Lipids mainly. It is composed of lipids mainly and proteins. Lipids and proteins. The most important lipid include the dipalmitoyl phosphatidyl choline. This is the most important phosphor, or the most important lipid. Of course, there are other phospholipids and cholesterol, but the most important lipid is the dipalmitoyl phosphatidyl choline that makes up the surfactant. So it is not the only constituent. Surfactant also contains phospholipids, and also cholesterol is found in what? Surfactant. Then the important proteins are surfactant proteins A to D. These are the most important surfactant proteins. So the lipids reduce the surface tension, while the proteins play a role in immune defense. That is what the proteins do. So we have got surfactant protein B and surfactant protein C. So these ones, they facilitate the absorption and spreading of lipids in the alveoli. So these ones play a role in distribution of the lipids, the diapamithyl phosphatidyl, choline, and other lipids. So they facilitate the distribution of these. And then also they are, which is essential for maintaining the structural integrity of what? Surfactant. Then surfactant proteins A and D, these ones play a role in what? Host defense by binding to pathogens and modulating immune responses. So the surfactant protein A and D are the ones that play a role in what? Immune defenses. Immune defenses. That is what surfactant proteins A and D do. So bronchial circulation is simply the circulation that exists in the respiratory system that aims to provide what? Oxygenated blood to the lung itself, excluding the alveoli. Excluding the what? The alveoli. So the bronchial circulation is the circulation system that exists in the respiratory system that provides oxygenated blood to the respiratory system, with exception of what? The alveoli. So they are bronchial arteries. So these branch from what? The aorta, and supply oxygenated blood to the bronchi, the bronchioles, and other lung structures, with the exception of what? The alveoli. Then the bronchial veins, these drain into the azygous and the hemiazygous veins, returning blood to systemic circulation. Why the alveoli are not supplied by this oxygenated blood is because they in themselves have oxygen that is diffusing across them. Yeah. Then innervation is via the parasympathetic innervation is via the vagus nerve, which causes what? Bronchoconstriction, and stimulates mucus secretion. So it is important in reflexes such as what? Coughing. That is the parasympathetic innervation. So once a vagus nerve is stimulated, it will cause bronchoconstriction and also stimulates mucus secretion. Then sympathetic innervation is via the sympathetic nerves, okay, from the thoracic spinal segments T1 to T5, and these ones cause bronchodilation to enhance airflow as well as reduce mucus secretion. Then there's also sensory innervation via the vagus nerve and sensory fibers, which detect mechanical and chemical stimuli such as irritants or stretch, and then trigger reflexes like coughing and sneezing. All these are picked up by the sensory innervation. So what we have been discussing, this is just the respiratory functions of what? The respiratory system. Now, there are also non-respiratory functions of the respiratory tract. Olfaction. So olfaction, remember that there's an olfactory nerve protruding in the turbinates of the nasal canal there. So because of these receptors, they're able to play a role in what? Olfaction, sense of smell. Then the other one is vocalization. So because of the voice box that exists there, because of the voice box that exists where we find the vocal cords, you're able to produce speech. So it helps in vocalization. Then there's also defense mechanisms. So the lungs also play an important role in the immunological defense system of the body. So the defense functions of the lungs are performed by their own defenses and by the presence of various types of cells in the mucous membrane lining the alveoli of the lungs. So these cells are the leukocytes, the macrophages, the mast cells, the natural killer cells, and the dendritic cells. So these ones play a role. So for example, the lungs has the epithelial cells lining the air passages. They secrete some innate immune factors called the defensins and cathelicidins. The defensins and cathelicidins. So these substances are the antimicrobial peptides that play an important role in the lung's natural defense. So that's one way it's able to carry out defense. And it also helps in maintenance of water balance. So during the process such as expiration, there's water that evaporates through the expired air, and some amount of body water is lost by this process. So it's able to regulate water balance and also regulation of body temperature. So during expiration, again, along with water, heat is also lost from the body. Thus, the respiratory tract also plays a role in heat loss mechanism, so thereby contributing to control of body temperature. So these are the many ways in which these are some of the other non-respiratory functions of the body, of the respiratory system. Then there's also regulation of the acid-base balance. So the lungs play a role in maintenance of acid-base balance of the body by regulating the carbon dioxide content in blood. So carbon dioxide is produced during various metabolic reactions in the tissues of the body. When it enters the blood, the carbon dioxide combines with water to form what? Carbonic acid. And since carbonic acid is unstable, it splits into hydrogen and bicarbonate ions. So as the carbon dioxide, since it's volatile gas, it is practically blown out by what? Ventilation. So it is via that mechanism that it's able to regulate that. Then it also contains mast cells. There are mast cells that are found in the lungs. So these mast cells, they secrete what? Heparin. And we know that heparin is an anticoagulant and prevents the intravascular clotting. Hence its anticoagulant function because of the mast cells that secrete heparin. Then there is also secretion of the angiotensin converting enzyme. So the angiotensin converting enzyme converts angiotensin 1 into active angiotensin 2, which plays an important role in the regulation of what? Extracellular fluid volume and blood pressure.